As you can appreciate, as I say, many of you on the call may be existing customers, may have some experience in using some of our peels already. But for those of you that are new to our portfolio, we have a system or a variety of systems here which ultimately can treat almost every layer in terms of the skin, and this goes across all different types of skin Fitzpatrick types as well, and a number of different skin related conditions as well. So we will proceed through these in terms of the depth. So we will begin initially by looking at the epidermal and superficial formulations that we have. Just as a quick recap here, guys, in terms of the depths that we're talking about, although I will refer to these peeling systems as superficial or epidermal superficial in terms of the home-based systems that we have, we also have the medium depth and the deep depth peels. So in any context really where we're specifically talking about superficial or medium depth peels, we are specifically talking about our home peeling systems or our peels specifically which offer much milder pH in terms of the amount of exfoliation and the potency of the ingredients that we have. Once we consider our more medium depth formulations, this is where we may be targeting more severe or challenging skin related conditions, quite advanced stages of photoaging, pigmentation that might be within the basal layer or even the more superficial layer of the dermis, and quite deep structural damage as well to the collagen fibres and elastin fibres within the skin. And finally, we will consider our 3 peels which fall within the deep depth categories, and we will also discuss some sort of training considerations in and around those types of formulations that we have as well. So I think probably many of us on the call have some experience, to be fair, of using different types of chemical peels, different formulations in different brands. But in terms of a nice overarching definition that we can consider, loosely, when we discuss a chemical peel or the aim of a chemical peel, in some form, it is a type of skin treatment that's intended to improve the structure of treated skin by some form of external application of a chemical solution. And the whole point of that is that we are trying in some way to give a controlled wound to the skin and a varying degree or depth or type of stimulation of skin regeneration, which could be hyaluronic acid based, that could be elastin fibres, that could be collagen, brown substance, and so forth. Now, as I mentioned, before we dive into the nuts and bolts of trying to consider which types of peels may be best for which type of indication, there are some overarching factors which I think on grounds of safety are important for our as clinicians that we need to be aware of. Certainly, when we utilise different types of peel systems, AHAs, TCA formulations, etc., chemical peel solutions will have an overall pH of that formulation, which gives you as a clinician a very clear idea to some degree of how acidic or how alkaline that formulation is. So that's a very important consideration in relation to the bioavailability of the formulation as well. Different AHA formulations will have different percentages and different availabilities of the free acid within the formulation. Some might be highly buffered, some may be highly ionized. So these are important considerations in terms of potency and the strength of the chemical peel solutions that we use. When we've actually done a skin cleanse within clinic or even at home, I think something that's very important for us to look at and spend time assessing in clinic is the way that the skin often responds after that initial cleanse has been done. Because some patients might say to us that initially their skin feels quite tight. You might actually be able to feel more by tactile assessment, areas of skin or roughness that feel quite dry. And I'm mentioning this point here right at the beginning because very often areas like that on the skin that feel quite tight or quite dry should be barriered. And these are what we can consider hotspots or areas potentially where the skin barrier is compromised and potentially where that formulation may end up being taken deeper into the skin. We will cover various protocols in relation to the different brands that we look at. And I think going forward in clinical practice, when we utilise different peel technologies, we always need to be looking for the correct protocol and be trying to align to the best protocol for that formulation as far as we can. Acclimatisation in terms of preparation to that skin before the treatment is a very important factor. Some of the peel formulations we will discuss, particularly our milder peels that can be used at home, don't necessarily require any pre-treatment acclimatisation, but that's in direct reference to their pH and their actual acid bioavailability. But some peels do, and these are very important aspects to be mindful of. Some peel formulations that we have require a very thorough level of neutralisation, and that's critically important and something that, of course, we cover in much more detail in our hands-on training. We should also be making a point, I think, during our aesthetic consultations of being mindful of certain cosmetic procedures that do affect the integrity and the barrier of the epidermis. And these are well known: electrolysis, waxing, shaving, prior peels or dermabrasions, and also caution with hair chemical treatments, because in some way these can also disrupt or damage the skin barrier itself prior to a peel. So that acclimatization is a really important factor, because ultimately that can be in direct reference to the Fitzpatrick skin type as well. And certainly I know my dear colleague Deja will be covering this in more detail on her Skin of Colour webinar tomorrow. But for sure, the Fitzpatrick skin type is critically important, and also that genotype and phenotype argument in terms of how skin responds to certain trauma, UV exposure and so forth, because that gives us some idea of how well prepared that skin needs to be. What does that medical history look like? Is there a known history of allergies? Can our patients tell us what kind of aesthetic treatments or even skincare ingredients? What's their existing skincare regimen looking like at home? Do they use anything at all? And specifically, I think certainly in our training sessions, we try and encourage many practitioners to utilise different types of skin assessment prior to peeling, or even actually in relation to recommending certain home care regimes. A simple woods lamp or looking at skin under UV can tell you so much in terms of existing oil content, bacteria on the skin, and often depth and presence of different types of pigmentation as well. Is there a known history of herpes? What's the frequency of an eruption, maybe over a 12-month period? And what kind of prophylaxis might we need to consider? Are they taking any types of photosensitizing medications? And again, the condition of skin barrier is critically important in relation to whether it's suitable on that day. If they have been using acclimatization products beforehand, how have they responded on the day of treatment? And is it appropriate to still go ahead with that peel? What is our level of expectation versus the patients? Are we on the same page? Is there a realistic level of understanding? And is the expected outcome the right one in terms of what they're expecting for the pill that you're offering them? Because we have some pills within our portfolio which offer clinical results that are comparable to a medium depth peel, but the results can take up to 6 months, as opposed to getting the results over a month with a deep peel treatment. In my philosophy, at least, I think the compliance to the home care to supplement the in-clinic treatment is very, very important. I think you can in many ways kind of liken this to going and spending a lot of money at the hairdressers and then coming home in that time between having your hair dyed and using a very cheap and non-discriminate product at home. Peels are invariably only half of the treatment. I think the commitment has to be there in terms of utilising the same regimen or the same ingredients from that peel portfolio as to what they're using at home as well. Pigmentation, remember, is only ever a symptom often of something underlying. Ideally, it should never be used in isolation as a diagnosis in its own right. And I think coming back to the medical history and the broader consultation and assessment we do, we need really to tread very carefully with pigmentation, because it can manifest in different ways and ultimately has one, if not many, underlying causes. So we need to be very clear about that, because as we look at our ingredients within all of our different peel options that we have just to treat pigmentation, these are all aligned to specific types of pigmentation that can present. Photography, I think, is absolutely critical. Often within our peel portfolio, we're looking at offering cell-by-cell exfoliation, chemical exfoliating treatments, certainly with our AHA-based treatments. And these are results that can come gradually over a period of months. And without appropriate and high-grade and consistent photography, obviously with consensual clarification there as well around specific uses, whether you're going to use that for social media publication or whatever. But I think the photography has to be consistent and the consent has to be there for that to have been taken in the first place. And what kind of evidence and clinical studies does that manufacturer or that distributor have in terms of justifying the outcomes and the protocols and even the ingredient formulations that they have? And is that ongoing clinical support there? You know, what are they able to offer you if there is any concern about adverse events, as an example? And the bottom in red, I think these are sort of fairly categoric, common sense. I appreciate that for sure. Chemical peels generally, as an overarching rule, would not be indicated pregnancy, breastfeeding, of course, nor if somebody's obviously actively on Roaccutane or even taken a course of Roaccutane, certainly in a minimum of a 6-month time frame before embarking on a peel. And for sure, individuals who have compliance issues in and around just using SPF, I would be very reticent about peeling. And certainly in terms of their overall attitude to sun exposure, these are serious red flags in terms of whether it's even appropriate to treat them in clinic or even at home with chemical exfoliating ingredients. And active herpes and dermatitis, of course, are key considerations in and around that as well in terms of postponing treatment on the day. So hopefully just some useful practical considerations in terms of what we need to be broadly thinking about in terms of rationalising our choice of peel in clinic. So the first peel that we're going to kick off with, as I mentioned at the very beginning, we are going to work through our portfolio in terms of depth. So we will start with the most superficial formulations that we have, which are our home peels, 6 in total, as I mentioned. Some of you may be familiar with our Skin Better Science range of products. And these are the Alpha Ret exfoliating peel pads, which, as you can see on the screen, come as individually sealed chemical peel pads, but these nonetheless are a clinical grade option. There comes a box of 30, and the key actives is the Alpha Ret technology. So just to remind ourselves, for those of us that might not be familiar with this brand, the Alpha Ret is essentially a very innovative and unique patented ingredient. It combines a retinoid and a lactic acid to give us a revolutionary double conjugated retinoid. So it has the Alpha Ret ingredient, the lactic acid, which is the highest concentration of these peel pads. So we have obviously the hydrating properties of lactic acid as well as the exfoliation, glycolic acid and salicylic acid as well. It's recommended that these can be used up to sort of 2 to 3 times a week for that added exfoliation if needed. Naturally, with these being a clinical grade product, it's usual for your patients to experience some degree of tingling, but it's very mild, it's very transitory because the lactic acid helps to obviously offer a lot of hydration to the skin as well. We have the exfoliation through the glycolic acid, and the salicylic is very useful, I think, maybe for individuals who might be suffering with sort of intermittent breakouts. I know stress is probably taking its toll on our skins at the moment. Many of us may be suffering with breakouts, whereas we may not have done recently. Salicylic can be a very useful beta hydroxy acid to unclog and reduce the appearance of pores as well. Obviously, with the clinical grade of these peels, whilst they are a treatment that are being done at home, it is still important, I think, to reinforce to our patients the importance of using an SPF daily when they start stepping up their skin regime to use actives such as these. Within our NeoStrata portfolio, we have our hero products, our NeoStrata Smooth Surface Daily Peel. Many of you will be familiar with our NeoStrata peeling systems, which we're going to look at shortly, but this is an at-home option. The box itself contains 36 pads. They actually come dry, and within the box as well, you also have your 60 ml solution containing the aminofill, the patented amino acid derived collagen stimulating ingredient, and the glycolic acid overall strength is 10% as well. So prior to use, patients will decant the entire content of the bottle into the pads. The bottle can then be discarded. And for those of you who use these pads can certainly resonate with my feelings that there is such a generous amount of solution, exfoliating solution on these textured cosmetic pads that very often we find that, yes, there's easily enough to treat the face. Very often there's enough to actually use on the neck or even the chest, anywhere perhaps where maybe the skin needs that exfoliation, where it's lacking that clarity, or there may be those textural concerns, even roughness on the backs of the elbows or the knees as well. But it's a lovely add-on as well for daily use if needed, or even just sort of 2, 3, 4 times a week. Brilliant at improving and brightening that skin tone. It doesn't need neutralizing in any way. Uniquely, for those of you, again, that may be familiar with our NeoStrata technologies, but uniquely we do have the amphoteric amino acid complex within this peel system. And the NeoStrata technology philosophy rests very much on using high acid and pure acid bioavailability with a slight amino acid adjustment. As you can see there, the arginine at 2%. And all this does, it's a type of temporary complex, and it forms a type of non-ionic bonding so that the alpha hydroxy acid becomes slowly released over time, and therefore the irritation potential is reduced even on sensitive skin. So it doesn't take away from the efficacy and the strength of that 10% glycolic acid. It just means that we get less irritation as a result. But the skin resurfacing we see with the 0.5% aminophil patented amino acid derivative. We do get some proven anti-aging benefits with these peels. It's not just about resurfacing and improving the textural irregularities. We get some collagen synthesis and hyaluronic acid production as well to plump and firm and improve the appearance of lines and wrinkles as well. They do contain a hydroalcohol-based solution, but it's very easily absorbed and it quickly penetrates within the skin. But these are paraben-free, fragrance-free, just with a 5% alcohol content. And again, quite uniquely, these are formulations that don't actually require that neutralization. So it's non-irritating, non-sensitizing, and that's thanks to this patented amphoteric complex that we have within some of the NeoStrata technologies. So moving on to another 4 now, we're going to look at 4 different home peels from the SkinTech Pharma group. Some of you, again, may be familiar with these, may use these yourselves, or may have these for your patients' home care regimes at the moment. These are a great addition. They basically come as 4 different types of peel. The first 2 that you can see here, we have the peel purifying solution, which is applied onto the skin. As you can see, the directions at the bottom of the screen onto clean skin. And this is a pH of 3.5 overall, so arguably strong enough from an acidity point of view to offer some proven chemical exfoliation, but no visible desquamation or peeling either, as we've seen from our other home peels. So we have a mix of glycolic, mandelic and maleic acid with a pH of 3.5%, and this can stay on the skin for approximately 2 to 3 minutes and then is simply washed off with cold water afterwards. And to really unlock and reveal that glow, this peel actually comes in 2 different formulations. The peel formulations you can see is the same, but then we have the 2 additional glow options afterwards. The first one is simply called Glow. We have the Steam Bloom, and it offers that moisturization and protection against internal aggressors and pollutants, and it contains vitamin A, C and E and the moisture complex as well. Alternatively, for skins maybe that have some early signs of photoaging, some fine lines, wrinkles, some signs of sun damage, we also have the brightening and the filling option as well, which is obviously the second peel. And this has tranexamic acid, which we're going to come back to shortly and talk about in more detail, but it is a cutting edge and proven ingredient in treating pigmentation. We'll talk about the mechanism shortly. And also has acetyl hexapeptide 38 and azelaic and glycine complex as well. This is probably arguably a little bit more advanced in terms of treating photoaging, the presence of lines and wrinkles, but also has the highly stabilized vitamin C as well. Within each box that you receive with Peel to Glow, you have the individual dispensers that you can hopefully see on the bottom right hand side, which allow you to drop the product out and to apply it into the skin, and that can stay on the skin either for the duration of the day. Very often there's enough solution left within the peel ampule to actually use a little bit the following day as well, because you can refasten that peel ampule back on to the vial as well. Our newest 2 peels that we launched to the Peel to Glow range earlier this year are our Beauty and Boost and our Sleep Repair. So again, similarly to what we've seen with the prior peels that we just discussed on Peel to Glow, the peel solution, the hydrobaric peel, is the same for both of them. And this one particularly is ideal for very sensitive skins, because one of the core ingredients that it contains, unlike its counterpart peels, is the lactobaric acid, which is a very sophisticated multi-mechanism ingredient, wonderful humectant properties, very powerful anti-aging effects for protecting structural collagens in skin and protecting the skin against damage from matrix metalloproteinases, but also contains the glycolic and citric acid for brightening and exfoliating, and the antioxidant complex as well. Same pH as the other peels we've seen at 3.5, but means it's very well tolerated for a sensitive skin. The Beauty and Boost Glow that can be applied immediately after that initial peel is washed off is a comprehensive formulation that contains 4 different peptides to repair and protect the skin, as well as treating those lines and wrinkles as well. With the hyaluronic acid, acetyl hexapeptide 38, pentapeptide 18, and acetyl octapeptide 3. Now, these are very unique peptides. They also feature within the RRS formulations as well, for those of you that know and use the RRS mesotherapy products from SkinTech. But these are very unique peptides in that they specifically target the appearance of lines and wrinkles. We also have the option of the sleep and repair as well, which is the fourth of the Peel to Glow formulations. So again, the peel, the hydrobaric peel formulation is the same. Once that's rinsed from the skin, your patient can then apply the Glow formulation, which contains the Defense Complex, melatonin, aloe vera, and the hyaluronic acid as well. So certainly for my patients at the moment, given these challenging circumstances, the complaints that, or the requests I've had for sort of, cost-effective options that people can do at home to maintain the effects of maybe their in-clinic treatments or give that skin some immediate brightening without any downtime. These peels, the Peel to Glow specifically, offer that, in abundance and a very cost-effective option. We also have them not just in the one ampule, as you can see, we have them also in 5 treatments and also 10 treatments, so exactly the same for all 4 peels. And alongside that, in case your patients were asking about using any additional SPF, because naturally we are talking about a clinical grade level of chemical exfoliation, and we're coming into some warmer weather now. We do also have the Neo Select, which is a spray SPF 50 anti-aging product in its own right. It's very lightweight, great even on a sensitive skin, absorbs beautifully, and also has the vitamins A, C, and E with that moisture complex as well. So that's another option that you could use alongside the Peel to Glow as well.